Christy, Alexandria, Virginia, the great WMALA general surgeon. How are you?
I'm good, sir. How are you doing?
Very well, thank you.
I am actually active duty in the Navy, and I am a general surgeon. I finished my residency in 2008.
Well,
and I missed a lot of your conversation with when the other general surgeon that I guess he had gotten on. But I guess going back to some of the comments from other people about that you wouldn't be getting health care if you don't have insurance, blah, blah, blah. We did our training at 2 level 1s and a level 2 for trauma in the civilian sector my 4th year, and there was not one person who came in from gunshot, stabbing, car accident, etc., that did not go to OR if necessary, get hospitalized, get medication, treatment, etc., just because they didn't have insurance. We don't check. And actually, I believe you're not even allowed to check. It's not something we discuss. We don't ask.
Well, Christy, he made the point. He said not only do we treat everybody that walks in the door identically, but he said what this is going to do is, and I'm paraphrasing because we didn't have long enough, but he told my call screener this is going to be a disaster because it's going to create shortages of doctors, shortages of supplies. Technology is going to be a big challenge now. Everything running through Washington, bureaucracies and so forth, it's going to be very, very difficult.
Oh, he's exactly right. And we're already having shortages of physicians, especially of surgeons. And in our community, we keep talking about, we call people FMGs, which are basically foreign medical grads. Those are the people that are going to be brought over to replace our physicians because we can't produce enough of them, and people are going to leave. It's not going to be satisfactory for us to provide our service, which is, again, healthcare is a privilege because it's a service we provide. Then people are going to get out of medicine altogether, and you're going to have people replacing them who are not as trained or as well educated.
So when Sheila Jackson Lee says if we repeal this, more people are going to die.
I find that quite humorous, considering that regardless of who you are, what you have, what you don't have, when you walk into a hospital, you cannot be turned away. In an ER, you have to be seen, you have to be treated, and for my patients in the trauma service, not one of them left the hospital without either being put on some type of insurance, mainly Medicaid, or if they couldn't get on an insurance plan or be transferred to a lower level of care, they physically were not allowed to be discharged. And we had people in the hospital for weeks or months just because they wouldn't know where to put them, especially homeless. They live in the hospital.
All right, my friend, thank you for your service and thank you for what you do. And I hope I never need a general surgeon, although you never know. But God bless you. We'll be right back.